So we have been in this journey with i4 Technolabs and PlusPhysio with several physiotherapists down the line. We wanted to find out from physiotherapists their pain points, the problems that they face when doing the treatment, when doing the follow-ups, when maintaining records. We discovered from a very fresh physiotherapist to somebody who's been in the field for almost 20-25 years. We understood their pain points, we understood their requirements, but who better than the head of the department of such a famous hospital like KD Hospital? We have with us today the head of physiotherapy, KD Hospital, Dr. Sudarshan. Dr. Sudarshan, welcome.
Sorry.
So, Dr. Sudarshan, we are basically a software company, but we don't want you to give us a take on software. We want to understand that as the head of the department in physiotherapy, you and your team must be facing some kind of challenges, when you get a new patient or when you get an old patient back. So, what are the challenges that you generally face?
Of recently, with new documentation and the IT profiling and all that happening, the challenges are definitely less. I've been head of department of KD Hospital for the last few years, but before that, I've handled various other hospitals. Also, I've headed departments in nearly 3-4 hospitals over my career.
How long has this career been, sir?
About 30 odd years.
So, you've been using a software since 30 years?
Software? I've never even used pen and paper in the initial stages of my practice. I mean, it was just a patient walks in, you treat him, he pays you.
Seriously?
And yes, that was how practice was in the initial days. Uh,
How did you maintain records?
What are they in those days?
So, if the patient comes back to you after 4 years, what would you do?
You scratch your head and try to remember who it was.
Or hope that the patient remembers.
Remembers. I mean,
So it was left to nature.
It was left to nature. I mean, those days it was totally different. When we started our careers, there was absolutely no record per se. During our schooling in physiotherapy, when they taught us, they definitely taught us how to assess the patient, maintaining records. But that stopped, I think, with our internship days. Right. Where you maintain the name, age, sex, and all of the patient, and
all that stopped at internship.
After internship, that goes for a toss, and then you jump into practice.
But that would not work in today's age, especially with insurance companies.
No, it will not work, and it should not work also. See, what happens is it creates a big lacunae. I mean, over a period of time, I've seen that sort of a practice change to a practice today where everything is digitalized. We have requests, the patient requests coming in online. Our treatment, our assessments are, you put your assessment and it goes online on the spot. We do the assessment and it gets uploaded online now. We do the what treatment we have given, that goes online now. See, I have seen it from the day when Sudarshan, there is a patient, to the day and there would be nothing. I mean, there is this patient can naam hota tha, and you go there, find what the patient had a problem
and treat it
from
without
scratch.
Any inputs from the doctor.
Not exactly. Yeah, see, that those days, I think the interaction between the consultant and the physiotherapist was a bit better because there was not so much volume of work. The number of consultants who actually relied on physiotherapy was not like today. And
physiotherapists are required almost in every field today.
Those days it was not like that. It was only in a
post-cancer, for babies, for gynecological problems, right from Kegels or pelvic disorders to even birthing the baby.
Exactly.
So not only that, I think the volume of physiotherapists in India has really increased, and so has the brain drain. The number of physiotherapists that India is producing, I think, is quite large, and only about a fraction of it stays back.
Yes.
But that fraction also is so overworked. I have never seen a physiotherapist who is free.
True, true. I remember talking about this brain drain somewhere in a previous interview with someone else. There was this question: why is there a brain drain? I said physiotherapy is about movement, and people
Are
physiotherapists
moving
want
out
to
of
move out
India.
of India. I mean, a lot of people in those days picked up physiotherapy just for the idea of going abroad. And anyway, coming back to our why
Why you were telling me about the challenges that you and your
challenges,
team
yeah.
faced, and most of it is
See,
with
those
records.
days, initially when these record keeping came, uh,
Mostly by, I think, requirement of insurance companies.
insurance companies, it was a challenge. We could not, I mean, because we had not done it, there was a lot of friction. Even I faced a lot of hiccups in doing it. You know, all that I had to do before was go see the patient, treat the patient, call up the consultant, and say, this is
Done.
what was found, and this was what. But then, this was, see, it is physiotherapy is, and actually it is not just physiotherapy. I think the medical field has moved on from a family sort of a setup to a professionally handled what do you call a sort of a it's more like an industry now. I mean, let's face it, it's an industry. It is not just the if you talking about it as an industry, it's we need to talk about the volumes. The volumes have grown up. The depth of practice is definitely
Increasing.
increasing.
My next question was going to be that only, that most of the team, I mean, when you have a patient, the patient has arrived and the patient is being discharged. So that problem which is starting from the arrival to discharge, there must be a lot of hiccups on the way as well.
Yes,
So we wanted to know, these hiccups that you're facing, are they very large in number or they are large in frequency?
uh, see, it varies between patient to patient. I think we should, if you see, when a patient walks in, we never had a end point uh, explained to the patient in those days. I mean, okay, we'll achieve till here, and that's when you'll have to be happy. There are certain times you cannot achieve 100%. See,
Now, so you have to tell
you have
patient
to
that
tell
please
them
continue at home and come for a checkup after 6 months.
6 months.
You can't
You
stop.
can't stop. Those days we could. It was now there is someone else. We'll have to give outcome measures. There are everything has to be documented. Whether we've
And that is why records are
records
important.
have to be maintained. If we don't maintain, if we practice in the same old style, we're not going to have.
So the patient comes after 4 years. How will you remember what you did
You
and
cannot.
what you advised and whether he has followed it or not?
It's we need documentation to
Initially, when
tease
before
the
you
line.
started using a software, did you ever at any time use pen and paper? And
For some
now
time,
that you're
yes.
using documentation with the digitalization, do you see a difference if you're using pen and paper
I've
and when
used
you were
pen and
using?
paper for a few years, but
This speeds it.
digitalization is
I
speeds it up.
started my practice in 2002 and I have not done it without records. I had a software even at that time. There was
Wow.
only one software available in India, but from 2002 I was using it. So I understand. Today I meet a patient after 26, 30 years on the road, and if I happen to have the name in the software, I know exactly which tooth I treated. And when I say it's your right molar, all right, the appreciation in their face.
God.
And it's not me who's remembered it, it's the software.
This software, yeah.
But I get the credit. So I completely understand as to what you're talking about.
It's
Talking of records and getting the credit what digitalization is doing, I wanted to know from your personal experiences that when you are having patients and you are planning a treatment, and this treatment plans what you're giving meeting out to them, maybe over a period of 1 year or maybe just 1 month, is it getting affected because you don't have records? And if you had access to old records, do you feel that patient recovery would be better? And are you actually seeing that difference in patients that you're working on right now?
it's a very valid. I mean, it's a really big pain point. See, uh, without records, that patient, what I did and what was the outcome, only I knew. Now, if I had maintained those records, I could have shown it to the next generation. This can give you this result. And I mean, today in a critical care setup, they talk about early mobilization and what do you call activity.
My question was basically the hiccups that you face. No, he's not recovered. He's not recovered. But now you have access to the recovery. The chances of recovery are higher. That is my question.
Yes. That is what I'm coming to that.
Okay.
The same thing, this early mobilization, I did it about 25 years back on a ventilated patient. I had taken that patient on a vein circuit and mobilized that patient. But there was no record that I maintained that this was done. That was done so that the early mobilization will help in mobilizing that lady. It was an old lady with scoliosis. So that mobilization, I could have maintained it. I could have showed it to the next people. See, this early mobilization stopped for quite some time, and now again it's come back as a new system, which
my mother was operated for a spinal surgery. 8 vertebrae were corrected. Bone cement was put in. She has 6 implants, and she was walking in 24 hours.
See,
and I know that if this had happened some 2 or 3 years back, they would have made her stay in the bed for a good 14, 15 days.
That is also not true. There were people who were mobilizing, but it was not documented. This is what,
that is the beauty of documentation.
That is a beauty. What we've done, I'm not an elephant to remember, but I remember this one case, but there must have been few other things which I've done over a period of time, which even I might have forgotten. It's not fair, even in my practice. And
so that is one thing that digitalization has overcome for you.
It is definitely overcome, because whatever you're doing new, you have to document whatever. I mean, if I turn the patient, I have to document that. That is what the documents require. Digitalization. I mean, there's someone watching you, and you doing that.
Is it easy for you to remember what appointment you have given when? Like, suppose a patient calls you up on the phone and says, I want an appointment at 3 p.m. And you probably might have given an appointment at 3 p.m. to someone else. So how do you schedule that? In the diary? In your mobile? You said you don't use documentation. That's why I'm asking you.
In my initial days of practice, 3 p.m. appointment, I was there at 2:30, when I did not have. But over a period of time, when the practice picked up, I mean, there are times when I really goofed up and
had 2 appointments at the same time. So that's the beauty of software.
Yes.
Especially AI software.
Yes.
With a calendar in it.
I mean, yeah.
So that would probably help and save a lot of goof ups, right?
Major goof ups. I mean, actually, time management for a physiotherapy is a key component of his practice.
And if AI is taking care of it, would AI be your friend?
I mean, that's
another thing. You said
you're pinching in the wrong, the most painful area, because all this should have come a few decades back.
Another thing that you told me, and it struck me as a valid point, and which I know that software take care of, was that you don't like to keep records, even pen and paper. But what if you were just having a normal conversation with your patient and AI was recording it and would make a quick summary, an AI summary, and send it to you as well as the patient?
This is unfair. This is unfair. You guys, I mean, bringing
that would be a wonderful software, right?
Not fair. Not fair. I mean, I mean, this should have been there a few
30 years back.
I mean, it would have made I mean, yeah.
There are a lot of other things that AI does. Like, for example, no patients are similar.
Yes.
They may be short, they may be tall, they may be fat, or they may be thin. Now, according to that, your physiotherapy regime may have to change. Not just the exercise, but the length of the exercise, the frequency of the exercise.
Everything. Say, for example, we gait train a person. We put blocks at regular intervals. We come to a conclusion, okay, this guy's cadence should be like this. This guy's stride length will be like this. But if there is a
software which tells you that because this is his height, this is his weight, this should be the gait. Would that work for you?
That would definitely work because
Second thing, let me tell you what else software can do. Not only can it tell you what is the treatment plan, but what if it were to tell you that if you don't do it like this will be the outcome. A predictive model, which you can actually show your patient. Would that work?
that would be motivating. That would really motivate a patient. Say, for
And
example,
still a little point further. If that same AI could be fed into an assisting physiotherapy machine, and the actual dynamics of the patient is fed into the machine, and the machine is assisting the patient to do the exercise the way you envisioned. Now, what would you say to that kind of a software?
not fair. I mean,
You would use it, right?
of course. I mean, I would grab it with. I mean, I just have two hands. I would
There
grab
are
it with.
software like that. There are software like that, not only assistive, but they are predictive as well as they help in the treatment
I
plan.
thought it would be coming down in the near future. I've always.
So it's already there in the
Yeah.
market, and there are physiotherapists using it, and many of them are not aware that such softwares are there, and
Including
that
me,
is why this.
including me. I mean, okay, there are times when, for gait analysis, that was a bit later when these mobiles had these cameras. I mean, me and a few friends, we put a few cameras around and analyzed the gait and shot it from different angles, and then we analyzed the gate. That was our first gate lab, that Jugaad gate lab which we made. Now,
Imagine AI doing it today.
now I know that AI does it with
Everything.
force plates and everything in 30 seconds, and this took us about half an hour just to think where to
You
keep.
used a software or an assistive therapy like that?
See,
In KD
personally, no, KD Hospital, we are coming up with full fledged department in which is going to be state of the art. We've got a exercise machine which is AI driven. That's a beautiful thing.
What does it do?
It's you put your phone. There's an app on it, and you connect it to that device. It remembers how much of exercise, what was the workload done, how many repetitions was done, what will be your goal for today, and you can do.
But this is an app.
This is an app and a machine. There's the machine.
Maintaining records of that patient?
It'll be maintained on his own phone.
Okay.
You and the patient are the only people who can access that record.
Okay.
It'll be maintained on his phone.
So that was very helpful.
It's beautiful. I mean, you don't have to. You don't have to say, for example, if I have 15 patients, इसको कल 5 किलो किया था कि 5.5 किलो किया, कितना reps किया, biceps किया था कि कल मैंने इनका. See, if you have 3 patients, 4 patients, probably you can maintain. You can have your pen paper. Now it's a time of volume. There's huge inflow of patients, huge inflow of. We're not talking just about patients, people who want to be healthier are also walking into physiotherapy, so I mean the volume, and those days patients really needed physiotherapy. I mean, patient chal liya to bahut ho gaya. Those were the days. Now people want
to
run and be perfect, it's so when you want this sort of thing, you talking about a totally different paradigm of people. You have to have all these gizmos to see you through the day. Otherwise, you go berserk. You definitely go berserk.
AI has definitely made life easier for a very large volume of people, including doctors, and I think especially physiotherapists.
It is. I mean, it's going to be a huge wave in the next.
Like I said, AI has got predictive models. Whatever data you feed in, and you can actually predict that this is going to be the end result. Maybe not be perfect to the T, but close to it. So, if you were to get a predictive model like this, how would you utilize it?
See, a predictive model, we giving an input of this is the amount of exercise you're doing with us. This is the amount of, say, for example, with the sort of softwares that I'm looking at. I mean, this the patient's follow-up or what he's going to be doing at home is also going to be recorded, and then the flow pattern sets in. So with that, I know this patient is being following, and then I know this patient is going to have a recovery. And if it is not happening, then I know my desired outcome is definitely not going to be there. Now I can get back to the patient and find out what is the problem with him. One, okay, now I have a model. See, I know that the path is going like this, and probably for some social whatever reason, a patient is not following it the regime properly. I know the prediction what is going to happen. Now, if that is going to happen, then I make some tweaks in my exercise protocols, which is more conducive to the patient and bring back the curve back to the normalcy. I mean, if I have someone who's going to tell me, "ये जो ज्योतिष है तो फिर everybody is going
Not
to
only
grab
is
it."
it helping for
Yeah.
patient education, it is helping your treatment plan.
Exactly. It's like I know what is going to happen in the future, where I can tell the patient this is going to be your outcome if you do this. It tells me how I can tweak my exercises, how I can make
So
subtle
the predictive
changes.
model will be just as good as the treatment, as well as the records, as well as the appointments. So now with so many options, do you think every hospital should have it?
Had it.
Okay, should have had it. You're going retrospectively.
I mean, see,
But now I think for talking about now,
in the
you think
future,
it should have it.
I think it would. I don't think there is an option left whether should they have it. I mean,
So you think AI is going to
I
replace?
doubt whether there
So
is
you
any
think
other
AI
things.
is going to replace physiotherapists?
Well, if you
Human physiotherapists.
if you think did I mean, see, did electricity replace fire?
No, it did.
It cannot.
That's a very good simile that you've given.
But
does it make your life easier?
It would have made it easier had it come a few years back. I keep repeating the same thing like
Parrot.
yeah. But yeah, it is definitely going to make life easier for physios, and not just physios. The whole the environment of medical field. See, physio is just a part of the whole treatment protocol. There are actually there are itna moving parts in treating a patient. There's a physio involved, there's nursing staff involved, there is doctors involved, there are ward boys.
702 bones involved.
I mean, the family which is involved. There are people who are going to come and keep telling the patient, तुम गर्म पानी में ये डाल के पियो, तुम ठीक हो जाएंगे, कबूतर का खून घिसाओ, तुम ठीक हो जाएंगे. I mean, so many inputs, patients. So there's so many factors. But I think AI will ease the flow of things in the medical field. Not just, I would not want to restrict myself to just physiotherapy. It's going to be there. I think it is.
And it will not replace physiotherapists.
It cannot replace. No, it cannot. AI cannot replace anything. I don't think any. AI can
just assist.
Yeah, it is,
and make life easier.
AI, it's anything which is artificial cannot replace a human being at the end of the day. Well,
even those mammoth machines that physiotherapists are using nowadays to suspend people with multiple fractures in their body in an accident case, they are actually suspended from machines which help them to get their movement back.
Yes.
So even those machines cannot replace a physiotherapist.
No. They help. They help. Say, for example, you had these patients who had multiple, as you said, multiple fractures, or a stroke patient. Say a patient weighing about more than 100 kgs. The requirement of 2-3 physiotherapists to hold the patient up and make him walk, the confidence that the patient had. Now with all these new gizmos coming in, where you dangle the patient, you have a sling which supports the patient. The sling knows how much weight this patient has, what is the height of the patient, the length of his tibia, the length of his femur. Everything can be. I mean, those robotics are. I mean, they're
Amazing.
beautiful. You set it up, and
You get
I mean,
exactly what you
I
want.
used to say, apart from architects and artists, people who had the largest back pain was physios. I mean, I've supported patients who have 98 kgs when I was 50 kgs. I mean, and made patients walk. I mean, today I
And
don't have to
your
do
back
that.
is.
Yeah, your back is hurting every single day. I mean, you can't even express it. You know, people would ask physiotherapists, "Kamar dukh raha hai." I mean, this is all going to help you. See,
The
this is
first class that I had as a dentist was a physiotherapy class. They taught us neck resistant exercises. I've been practicing for 28 years. I don't have spondylitis. But that is a professional hazard of all dentists.
that is
But that was the first lecture. So I do understand. I have understood the importance of physiotherapists from before I became a dentist. And that is something that I think most people are recognizing in the world today. That how important you are. And that is why we wanted you to understand that we have got a gift for you, the gift of AI, the gift of a
it's
software which can assist you and actually make your life easier.
a little late, but but
Better late
better
than
late
never.
than never. Yeah, I've still got a few more years to click. I mean,
So
I
yes,
really
so
would love
an
to.
exposure to all this
This
AI
is it is
software
going to be
and
it's been a game changer. I mean, in a lot of things, if this is going to be a game changer, I think there's going to be a lot more happening in uh, AI and in the medical field.
you
It's
said that your patients are generally not discharged, but they are given an appointment to come back. So, in this entire chain, whatever I've described about the software that it can do for you, in this chain from when the patient comes to the patient being sent for recall,
yeah.
what have you noticed are the biggest pain points? And maybe our software can be modified still further to cover that pain point.
See, as I said, when a patient gets discharged, it's always like continue physiotherapy. That's all that's there in the discharge summaries of most of the discharge patients. Continue physiotherapy. What you know? These are the exercises that they have to. Okay, let's say you have to move your shoulder. How many times? What range?
Plus, Physio has almost all of the things that you specify just now. In fact, I think there is very little it doesn't cover. So, it has already been created for you before you asked for it.
I think I should get up and start dancing. I mean, it's going to be a lovely thing that something keeps coming. It's beautiful that someone's really thought about all these nooks and crannies of practice.
Thank you. Thank you very much for such an interactive and informative session with us and for actually telling us what a physiotherapist really needs. That too, the HOD of KD Hospital Physiotherapy Department, because your exposure is definitely much more than any other physiotherapist. And we thank you for your information, for your valuable time, and your presence here with us today. Thank you very much, Dr. Sudarshan.
I should be thanking you for you people to get something out like this for the physios who are practicing and who are going to come into the field in the near future. I mean, thanks. I mean, honestly, this comes from the bottom of my heart, from the fraternity of not just physios, medical field, because it's going to go leaps and bounds. At the end, see, what we all want is a better patient outcome, a better pain-free society. I think if we're doing something for it, nothing like it.
True that. So that's all from us today.